What is the value of research in occupational health? What is the return on investment? Now that this funding is being taken away, we often get the question, what is the value?
At some point in our lives, we all labor and we all work. We've all had a job, so worker health and safety touches all of us. I'm Marissa Baker. I'm an instructor, but I also spend a lot of my time out in the community talking to workers. In 2023, over 80,000 workers got injured or were made ill at work. I think that that's a pretty large number. I would like to see that number be zero. Occupational health research here at the University of Washington has done a lot for workers in our region. We train folks who work in safety, who work in industrial hygiene, who work in occupational medicine. We perform research, collecting samples out in the field, talking to workers, proposing interventions to help make workplaces safer.
But on your boat, would you guys have enough room?
Without some of the applied work that we're doing here at the University of Washington, we will expect to see those numbers increase in Washington State and across the country.
Our ag, forestry, and fishing workers represent essential workers. We cannot function as a society without those individuals going to work every day. My name is Alina Austin, and I look at the health and safety of workers in agricultural workspaces. I think about their exposures, I think about the risks that they face, and I develop research that makes their job safer. So we've had a number of research projects that lead to practical solutions and practical applications, and we've been very proud of that.
What we learn from studying a population, for example, a group of workers in a certain industry, we can then bring that evidence-based information back to our clinical care and management. My name is June Spector, and I'm an occupational environmental medicine physician. Some of the conditions that are treated in an occupational and environmental medicine clinic include back injuries, carpal tunnel syndrome, lung problems that may be caused or made worse by exposures at work. There also is often quite a bit of paperwork, and occupational environmental medicine specialists are specially trained to actually handle that. The program at the University of Washington is the only program of its kind in the region, and the clinic here offers training that is really not available at other clinics in the region. All of those things are tied together into a healthy workplace, a healthy community, and a healthy economy.
For every dollar invested in health and safety research, there's a 3 to 9 time return on that investment. It also means that people are going home safe, and they are with their families, and they are working and contributing to our society.
You know, the reason I think occupational health is really important is because work is such a fundamental part of our lives. So it should also be a place that keeps us safe and gets us home to our families in the same condition that we left in the morning.